At the heart of the news, the 19 new measure of COVID-19 in Cameroon. Bars, restaurants, and leisure facilities have been authorized to henceforth open after 6 p.m. without the obligation for customers and users to respect barrier measures. This is part of some 19 new measures taken by the head of state and announced by the Prime Minister, head of government, Chief Dr. Joseph John Gutte. According to the head of government, the aim is to limit the impact of the health crisis on the national economy and as well relieve some of the sectors hard hit by the pandemic. As such, bars and restaurant owners can now extend their closing time after 6 p.m. but must ensure customers respect barrier measures, including social distancing and the wearing of face masks. On the other hand, transporters have been given to go ahead to function as before, but with the obligation to avoid overloading and ensure passengers put on face masks. In fact, apart from the 18 fiscal and financial measures suggested by the GCAM, which include a break period on the collection of some major corporate taxes, the Cameroonian government instead responds by a moratorium of payment during this pandemic period. Guinea-Bissau, through the President Umaru Sissoco Embalo, received a consignment of COVID organic, the Malagasy herbal tea, tested as having preventive and curative abilities for COVID-19. The President expressed his satisfaction in this word. This donation parts of the fight against the global pandemic called COVID-19. I would like to say that with this, Guinea-Bissau will be seen as a different kind of nation. It will be seen as a country that still has good people, and the world will talk about Guinea-Bissau. President Hajaolina of Madagascar intimated that the donation was for countries across the region. The tonnage and type of COVID organics remains unknown. The packages received by the head of the Guinea delegation were branded with flags of different economic community of West African state nations. As of today, donations have been officially made to Equatorial Guinea and Guinea-Bissau. Republic of Congo, Tanzania, and Comoros have also publicly expressed interest in receiving donations. President Hajaolina has also spoken to leaders of Senegal and the Democratic Republic of Congo, with both peers lauding the Malagasy effort. Meanwhile, the Africa Centers for Disease Control, Africa CDC, last week confirmed that treatment trials are on the way across 5 African countries, but did not mention the Malagasy cure. In Tanzania, coronavirus test kits were dismissed as faulty by President John Magufuli on Sunday because he said they had returned positive results on samples taken from a goat and a purple. Magufuli's government has already drawn criticisms for being secretive about the coronavirus outbreak and has previously asked Tanzania to spray the coronavirus away, said the kit imported from abroad had technical errors. The president instructed Tanzania security forces to check the quality of the kit. These samples were then submitted to Tanzania laboratory to test for the coronavirus, with the lab technician left deliberately unaware of their origin. According to President Magufuli, there is something happening and we should not accept that every aid is meant to be good for this nation. And he added that the case should be investigated. As of Sunday, Tanzania has recorded 480 cases of COVID-19 and 17 deaths. COVID-19 infection and fatalities reported across Africa have been relatively low compared with the United States, parts of Asia and Europe. But Africa also extremely low levels of testing, with rates of only around 500 per million people. African oil producers are being impacted by Organization of Petroleum Exporting Country production cuts. African oil production nations have not been spared the impact of the global decision to reduce oil output. About 14 countries in sub-Saharan Africa produce oil, which account for most of their annual export income. The COVID-19 outbreak has reduced demand for oil due to isolation and travel restriction measures introduced globally to slow down the spread of the disease. African major oil producers include Nigeria, Angola, and Gabon. A rise in oil prices between $15 and $16 will allow them to earn badly, needing foreign exchange to carry out development projects. The World Bank and the International Monetary Fund have urged African oil production nations to diversify their economy to reduce their overdependence on oil to improve the living standards of the people.